Do you have anxiety? Or are you just a little nervous? If you want to know for sure, keep watching. In this video, we'll be discussing how to know if you have anxiety. We also talk about how to know whether your anxiety is serious, it needs more attention, or whether it's not. It's serious, and you're just a little nervous about something. You'll also learn about the symptoms of anxiety. Over the past 30 years of my career as a nurse and a hypnosis health coach, I have gained a lot of knowledge about anxiety and how to know whether what you're experiencing is anxiety. I'll also share with you something that you can do to manage your anxiety if you're unable to consult your doctor. These tips and techniques do not require medicine or an office visit, so you can use them whenever the need arises. Make sure to subscribe to this channel so you do not miss out on any upcoming videos. Okay, let's get started and how to know whether your anxiety is severe or not. But before we do that, we need to start by describing what anxiety is very quickly. After all, how do you know if you have something when you don't even know what it is, right? So very briefly, anxiety is a non-medical term that refers to a feeling of fear or worry that often relates to a particular issue or concern. It generally occurs when a person feels that something is bad, like something bad is going to happen. It's something, and sometimes defined as a worry or nervousness about something with an uncertain outcome. You need to realize that anxiety is usually a very normal response to a life event that's very stressful. These stressful events include things like a job interview, that first date, moving from your old home into that new one, changing your job, or having financial difficulties. In fact, many people experience anxiety at some point in their lives. Anxiety only becomes a problem when the symptoms of your anxiety become much worse or larger than the event that triggered them and start affecting your life. This is because the symptoms in such cases can be signs of a more serious problem, such as a disorder, depression, or other areas of mental health concerns. So if your anxiety causes you to worry about something a little, it's normal. But if it causes you to do drastic, extreme, or irrational things, then you could have a real problem. The most extreme example of irrational behavior due to anxiety I have ever come across was in a TV show called Rick and Morty, an animated science fiction sitcom that I saw about 3 years ago. And in this episode, Rick, who is a crazy scientist, decides to turn himself into a pickle because he's depressed and extremely scared of going for counseling with his family and confronting his feelings. That was his genius way of avoiding all human responsibility and loss of love. So this anxiety had him turn himself into a pickle. Imagine that, a pickle. Of course, this is an extreme example of anxious behavior. But anxiety does cause many people to act in a similar way, though to a lesser degree. Luckily for you, if you continue watching this video, you will not have to turn yourself into a pickle, because you're going to learn how to tell whether or not anxiety or what to do about it. Despite how it may seem, anxiety is usually very manageable. The best way of knowing whether you have anxiety or not is to look out for symptoms of anxiety. Remember that symptoms of anxiety become excessive and start interfering with your life. It could be a sign that you may have an anxiety disorder. Here's a list of the most common symptoms of anxiety. 1. Excessive and irrational thoughts and worries. The most common symptom of anxiety is excessive worry. The worrying is associated with anxiety disorders is disproportionate to the events that trigger it. If you're worrying more than usual about situations or effects that happen, it could be a sign that you have an anxiety disorder. If you experience worry and apprehension on most days over a 6-month period, then consult a healthcare professional because it could be a sign that you may have a generalized anxiety disorder. The worrying must be severe and intrusive, making it difficult to concentrate and accomplish daily tasks. Number 2, restlessness. The second symptom of anxiety is restlessness. It usually occurs with children and teenagers. However, it often occurs in adults as well. If you're restless, it's a sign that you might be experiencing anxiety. When you experience restlessness on several days over a 6-month period, this may be a sign of generalized anxiety disorder. It's well for you to consult a doctor or healthcare professional. Number 3, having trouble falling asleep. Insomnia. Anxiety generally causes sleep problems. A person with anxiety usually will have trouble sleeping or usually wake up in the middle of the night. And if this is happening to you, then you might be experiencing anxiety. 4, avoiding social situations. This entails feeling anxious or fearful about upcoming social situations. In this scenario, anxiety causes you worry that you might be judged or scrutinized by someone else. It may also cause you to be fearful of being embarrassed or humiliated in front of somebody else. The anxiety may also cause you to avoid certain social events because of these fears. This feeling is quite close to wanting to turn yourself into a pickle, so you may avoid other people, but to a lesser degree. Number 5, irritability. Anxiety also causes irritability. So if you're easily annoyed or irritated, there's a good chance that you are experiencing anxiety, especially if you have the other symptoms. Number 6, difficulty concentrating. Difficulty in concentrating, especially in daily tasks, is a symptom of anxiety that you also need to look at. Number 7, sadness. People with anxiety tend to experience sadness as a result of whatever is triggering the anxiety. 8, panic attacks. A panic attack is an attack where you go into a rush of panic. It usually does not have a specific trigger, and it can happen without anything triggering it. It can be a symptom of a panic disorder, which is a diagnosable condition. Panic attacks can happen whether you feel calm or anxious, and they involve physical symptoms and feelings of terror, so intense that you feel a total loss of control or immediate death. During a panic attack, you're likely to believe that you are going to die. The attack often occurs suddenly and unexpectedly and lasts between a few minutes and an hour. But the negative impact of the attack may continue even afterwards. For more details on the difference between anxiety attacks and panic attacks, see my video titled, "What Does Anxiety Feel Like?" Having discussed the main symptoms that I've described, here's a few quick list of the physical symptoms of anxiety. Changes in heart rate. Changes in heart rate is a common physical symptom of anxiety. It changes the rate of your heart rate from what is normal. Other symptoms include nausea, dry mouth, tension in your neck or your head, tightness in your throat, difficulty breathing, headaches, sweating, trembling or shaking, feeling faint, a pounding heart, an upset stomach, and dizziness, and also frequent urination, stomach upsets, shortness of breath, diarrhea, muscle tensions, twitches. I'm sure by now it's obviously clear that there's many symptoms to look out for, and that it can be very demanding and nerve-wracking to know whether you're having anxiety because of its many symptoms. So here are a few questions you can use to quickly determine whether you're experiencing anxiety or not. Are you constantly worried, tensed, or fearful? Do you worry or become so anxious that it interferes with your sleep or your ability to concentrate? Does your anxiety interfere with your daily life at work, school, or with your family? Do you experience repetitive? Do the thoughts upsetting and undesirable? Do you avoid places and daily situations or activities for the reason that they cause you anxiety? Do you experience unexpected attacks of panic that cause your heart to pound? Do you think your life would be awesome if you were a pickle? Okay. I'm only kidding about that one. But if you said yes to at least 3 of these questions, then there's a good chance that you have anxiety. However, there's no reason to panic. Mild anxiety can be dealt with by using the following simple self-help remedies. Manage your stress. Managing stress is an effective way of dealing with anxiety. A lot of anxiety can be caused by high levels of stress. Look at your responsibilities to determine which ones can negatively affect you. Delegate those, give them up. That is one of the effective ways of dealing with stress. Connecting with people. Loneliness, isolation can trigger or worsen your anxiety. On the other hand, talking about your worries, your fears, face-to-face with close friends, family, often make things less overwhelming. Also share your worries and concerns with someone who you trust and care about. In addition, you can join a self-help group, a membership support group, to share your worries and your concerns. Practice relaxation techniques. Frequently practicing relaxation techniques, such as self-hypnosis, meditation, yoga, progressive muscle relaxation, and deep breathing can reduce anxiety symptoms. It also makes you more relaxed and balanced. Excuse me. Eating healthy and exercising regularly. Eating healthy is a good way of lowering the risk of developing an anxiety disorder. Although it's not enough to treat anxiety. In addition, exercise is a natural stress remedy and anxiety reliever. It's important to exercise every single day, at least for 30 minutes. Sleep. Get enough sleep. Not sleeping enough can worsen anxious thoughts and feelings, so try and get at least 8 hours of quality sleep each night. Avoid alcohol, drugs, cigarettes. Alcohol and nicotine, they tend to make anxiety worse. Avoiding alcohol and drugs will give you positive results and reduce your anxiety. Put a stop to constant worry. Learn to control your worry by using techniques to train your mind. You should also learn to accept uncertainty because this significantly reduces worry and increases calmness. If these self-help techniques do not substantially reduce your anxiety, then you should visit your doctor or seek professional help. Or call Medvesta Hypnosis. 630-974-1800 to ask any questions that you may have regarding anxiety. If you found this video helpful and beneficial and would like to see more videos like this, please subscribe to my channel and hit the like button. I release one new video every week, so make sure that you don't miss it. You can also email me at steve@medvestahypnosis.com or visit my website, medvestahypnosis.com. Find the link in the description below. Thank you for watching, and see you in that next video. And please, no matter what you do, don't turn yourself into a pickle. Instead, imagine your possibilities.